My name is Dr. Rachel Cohen, and I'm an audiologist, and my specialty is auditory processing disorders. I have a practice. It's located on the West Coast. It's called ListenHear, and our focus is listening and evaluations for auditory processing, and also the therapy. I think what I want most people to know is that we can start treating super young. Our test norms can go down to 3.5. And there is therapy that can help this so that by the time they get to kindergarten age or they're reading, that they're supported and their auditory systems are where they should be. And a lot of people don't even know that there is therapy or treatment for auditory processing. And it actually can be done by Zoom if the child is able to be sitting on a Zoom meeting. So we can actually do it from anywhere around the state. And I wish that more parents understood auditory processing. When we're looking at auditory processing and diagnosing it, these children have normal hearing, and then they're not able to process. So it's kind of like what our brain does with what comes into the ears. So it's getting through the pathway of the ears, but then when it goes on up, something's getting garbled in a sense. Yeah, so when a child comes in, a lot of times they're finding us pretty late. I wish there was more education out there like this to show to the teachers, to the doctors, pediatricians, ENTs, psychologists, even speech pathologists are struggling working on articulation and not bringing it back to the basics. They didn't hear the sound properly and process it, so then they can't say it. And you're going to work on that for years and not make the improvements you could do with 12 to 14 weeks of auditory therapy. So we meet once a week, 1 hour, that's it, for 12 to 14 weeks, and we usually see huge gains in processing. And first we do an evaluation to diagnose it. There's lots of norms. That test takes some time. And then we make a treatment plan. And usually what we're focusing on is listening and background noise, auditory memory activities, decoding activities, so they're hearing those sounds properly and making the right connections in their brain, and then blending sounds into words. And when we do that, all of a sudden, their reading gets better. It's just an outcome that automatically happens when they start processing better. The kids that go through our program is really life-changing. We're taking a child who sometimes doesn't know to read at all, and then they're going through auditory activities, and suddenly they're learning to blend sounds into words. They're quickly and accurately understanding speech that they hear in their environment. They're calmer, they're more focused and able to attend. And therefore, when they're sitting in a classroom, they're able to take in what's coming from around them, from their teachers, from their peers. There's not kids laughing at them because they're being laughed at because they said something off of a joke that they didn't understand or couldn't hear. And then their reading scores improve. They're not failing grades anymore, and they're able to catch up to where they should be. So really amazing. So what Bright Minds Processing is really doing here is we're trying to bring this awareness to everybody, not just in the state of Florida, but to all teachers, all professionals, about how auditory processing and visual processing disorders can really affect the kids' educations, and really has a huge impact. If it's not looked at and evaluated, especially early, the earlier the better. The outcomes when they're not being diagnosed can be pretty significant, and can really affect them, for the rest of their lives poorly. So getting this addressed early can really make a difference. So the work that Bright Minds Processing is doing right now is hopefully educating the public to know more about auditory processing disorders and visual processing disorders so we can make changes.